Federal help is on the way to help address the alarming number of Oklahomans dying from prescription opioid abuse. Here's the latest on the opioid crisis. Researchers say overdose deaths involving prescription opioids have quadrupled since 1999. Today, President Donald Trump vowed that the nation's opioid crisis, quote, will be defeated as he addressed the nation on drug addiction today. Tonight, Fox 23's Ashley Lincoln is live after speaking with an emergency room doctor who deals with this crisis every day. Ashley.
Well, Shay, Dr. Aaron Lane tells me he sees up close the impact opioid abuse has on his patients. He says it's a very complex issue to combat.
We see it every single day, ironically, in this room. It used to be something that we rarely see, and now it's something I see almost every day.
Dr. Aaron Lane tells me as an ER doctor dealing with opioid overdoses, it's their unfortunate reality.
And that's one of the things about this epidemic. It's people from lower socioeconomic circumstances all the way to affluent people. It doesn't discriminate.
Lane says in his last 5 years of practicing medicine, he's noticed a significant increase in opioid abuse here in Oklahoma.
We really need to reevaluate who we're writing these pain medicines for.
The Oklahoma Medical Board says prescription drug use is the fastest growing problem in the state. Of the more than 3,000 unintentional overdose deaths in Oklahoma between 2007 and 2011, 81% involved at least one prescribed drug. Doctors can now rely on a state database to make sure patients aren't abusing medications.
It tells you all the controlled medications or controlled prescriptions that they've been prescribed in the last year.
Lane says he's thankful President Trump is bringing additional resources to combat this problem.
I think that it's going to bring more recognition to the problem, and I think with more recognition we're going to come up with more good solutions to tackle this.
And Lane says another factor to this problem is that doctors are feeling the pressure to make sure their patients aren't in any pain. You may have seen some of these pain assessment charts in the local hospitals, and Lane says in some cases doctors are pressured to make sure that their patient's pain level is at that zero. Reporting live from downtown, covering news that matters, I'm Ashley Lincoln, Fox 23 News.